In this video, we will go through the pharynx. We'll look at the three different segments of the pharynx, what separates one segment from the other, and then we'll finish by describing some important viscera or content within each individual segment. So what I'm going to do now is I'm going to change this screen to look at a hemisection version of the head. So I'm going to remove some of the bones and fade some of the other ones. And I'm now going to turn to look at this from the lateral side. And let's begin by looking at the nasal cavity, which is all of this outlined here in pink. The nasal cavity continues posteriorly as the nasopharynx. The oral cavity, which is below here, continues posteriorly as the oropharynx. The structure that is separating the nasopharynx from the oropharynx is the uvula itself, which is dipping down at the back of the hard and soft palate. The oropharynx then continues inferiorly until we get to the tip of the epiglottis. And that is where we begin our third and final segment of the pharynx, called the Laryngopharynx. The Laryngopharynx spans from the tip of the epiglottis down to the beginning of the esophagus, which at a vertebral level is right at the bottom of the C6 vertebrae and also coincides with the inferior extent of the cricoid cartilage. So now that we've defined the segments of the pharynx, let's look at some unique content within each. So in the nasopharynx, if I turn this back over here, there are two main structures I want to point out. The first is the auditory tube. So the auditory tube is a cartilaginous structure that connects the nasopharynx to the middle aspect of the ear or auditory canal. If you've ever been up on a trip in an airplane or something where you've changed altitude, you've noticed that you've needed to quote-unquote pop your ears, which means you've needed to equalize the pressure between your middle ear and your nasopharynx. So keeping this tube open, this auditory tube, equalizes the pressure between each. Also in the nasopharynx is our first set of tonsils called the pharyngeal tonsils. You might also have heard these called the adenoids before, but that is the name given to these tonsils when they're inflamed. Now let's look at the oropharynx, where we have another grouping of tonsils. In fact, we actually have two. So I just moved slightly inferior here. And on either side of the oropharynx are the set of tonsils that most of you have probably heard of, and some of you might have even had removed, called palatine tonsils. In the oropharynx, we have another set of tonsils, but these are located on the back of the tongue, and these are called lingual tonsils. Tonsils will be discussed more in depth when we discuss the lymphatic or immune system, as they function to help mount an immune response if necessary, but we have a large collection of tonsils here in the pharynx. So I'd like to end this video by doing a quick summary of the overall function, again, of the pharynx. The pharynx is a conduit for air from the nasal cavity, as well as food, liquid and air from the oral cavity, as it passes posterior to either continue into the esophagus as a food and liquid, or pass anteriorly into the larynx if it's air.